Okay, good morning, everyone. This is my thesis defense presentation, and I'll be presenting my research paper on exploring the function of polymer-coated nanoparticles in the specific application of drug delivery systems. So a little bit about me and the topic. So why I chose this topic is because I aim to pursue the medical field. Drug delivery and understanding chemicals as a whole is a very important part of the medical field. So that is one factor, and nanoparticles specifically have a really high potential for development and treatment of many different diseases. So that's also another factor of why I'm interested in this topic. And outside of all that, I'm really interested in biochemistry. So I would like to know more about the certain caveats when it comes to modifying nanoparticles, what chemicals can be used to make them better. And yeah, that's why I chose this topic. And I'm also a senior at Queens High School for the Sciences at York College in New York City. And that's where I study on the daily. And with that, I'll head into the introduction. So the topic is mainly focusing on the possible complexes of nanoparticles and polymers together for their best usage in drug delivery systems. And the fundamental questions, even though they seem simple, are pretty nuanced. And the first one would be what properties are actually valued for these carriers, right? Because nanoparticles have a lot of different properties. And so you want to really define sort of like almost a list of what are valued for these sort of drug carriers. What do they, or what are you looking for, and what would be the best for ensuring that they complete their task? And of course, the second question that's from this paper and sort of the contribution to this paper is to the field is that what complex actually grants these properties with the least amount of drawbacks. So, like I said, these structures have a lot of different properties. So you want to see the polymer that and the nanoparticle complex actually grants the most useful properties while also granting the least amount of drawbacks. And the actual application is that it would bring about a good insight for and a set standard for drug delivery methods, because when I was doing my literature review, I noticed that a lot of papers are sort of kind of here and there about choosing which complex would be or which type of material they would use. So I want to kind of bring more insight into what is actually the best for drug delivery methods. And also they have many different applications in different diseases. They can just be used in general for drug delivery and IV and oral medications, or they could be used for direct like anti-tumor treatments. And so they have many different applications in these sort of diseases. And so that's what this topic is pertaining to. And with the methodology, I mainly used websites like PubMed, Taylor and Francis, and MDPI for collecting data. And since this is our literature review, I relied on previous trials and reviews that helped me reach a conclusion about these structures. And going into the background info. So when we look at nanoparticles, the main properties that these nanoparticles harbor is the ability of surface modification. And what that means is that they can be really modified when it comes to their surface. So you can attach a lot of different things such as polymers, you can attach drugs, you can attach a lot of different chemicals that can be used in these different circumstances. And another part of the nanoparticles and why they're so useful is because they have near perfect properties for cell diffusion and entrance into body systems. They have high volume to high surface area to volume ratio, as well as a good permeability for actually entering into the cell and administering any treatment to the cell. But however, the main downside is the toxicity, mainly with the inorganic nanoparticles that I'm studying in this paper. And they have many different mechanisms of these toxicity, and that's the main thing that we want to avoid when it comes to getting these complexes together. So that's for the nanoparticles. In terms of polymers, they kind of sort of provide properties to also add on to the nanoparticles, as well as lower the amount of toxicity that a nanoparticle can exhibit. And that's because most of the polymers that I explored are biocompatible, and they allow for low immunogenicity, which are both very good properties for drug carriers in general. And you can see in these pictures on the right that they sort of act as an extra layer on the nanoparticle, and that as well can also be modified to have any other sort of chemical or drug on it to actually enhance the function or enhance the drug loading of the actual nanoparticle. With that, I'll go into my literature review. So in my literature review, I mainly explored uh, three different topics. First, I explored the nanoparticle toxicity, the polymer function, and um, the actual application and the previous trials that have been done with these different complexes. So two main research articles that I want to describe here on the slides are first being a really helpful source, the research on biopolymer-based medicine in the context of treatments for cancer. So this paper mainly defined all the different natural polymers, including polysaccharides and proteins, that really allow for this sort of biocompatibility and biodegradability. And they also define that most of these polymers are marine occurring and have really sustainable productions because of that. And another one being the research on potential toxicity of iron oxide magnetic nanoparticles is a really good one because it also compiled a lot of in vitro and in vivo studies regarding the toxicity of iron oxide nanoparticles, and it sort of defined the main cause of the toxicity of many other nanoparticles as well, which is ion leakage. What happens is that when the inorganic nanoparticle goes into the body, it can actually leak toxic ions into the body, which cause oxidative stress and sometimes can even cause direct DNA damage, which is really detrimental. And so that's what we want to avoid when we're sort of looking at the complex that we want to form. And these are the results that I found. And so I compiled two of the tables in my research paper. The first table was too long, so I had to splice it out here. But the table one is showing the different derivatives of a very well-researched polymer called chitosan. Basically, you can see on the right of the table, it defines all the properties of the polymer, and it has mucoadhesion, it's biodegradable, it's cationic, which allows interaction with other negative charges to actually enhance cellular uptake. It has mucoadhesion, it has targeting, it has cohesion. So a lot of different properties that are present in the natural polymers, as well as one synthetic polymer at the bottom, polyethylene glycol. This one is very good as well. It has high solubility in water. It has thermal and physical stability, which is important for actually enduring the different types of environments that we can find in our body systems. It also has both of these polymers, the chitosan and polyethylene, have very high modification potential. So for example, if you took one polymer, you can actually modify it with chitosan or polyethylene to enhance that polymer, enhance the properties that it has. In the second table, I focused on the nanoparticles and their properties, as well as their toxicity. And so you can see on the right that I have the mechanism of toxicity, which I talked about earlier. We can see that silver and iron oxide in particular, as well as zinc oxide, have the phenomena I was talking about, the ion leakage, and that is really detrimental and causes cytotoxicity inside the cell and eventually leads to apoptosis. So those are the most toxic mechanisms that we want to avoid when it comes to nanoparticles. But of course, we can't just base it off of the toxicity. We also want to look at the physiochemical properties that these nanoparticles have. So we can see that in gold and silver, we have SPR, which is surface plasma resonance, which is really good for biosensors and bioimaging, but not really, can't really be applied to drug delivery because we want more blood circulation time and targeting. So with that, I looked at iron oxide and silica, and we can see that they have targeting, they have a thermal stability, and they have drug loading capacity. Even though they cause toxicity, they can potentially be good candidates for nanoparticles. So with that, I reached my conclusion about the actual best complex that the nanoparticle and the polymer together would be. And I reached the conclusion that spion, superparamagnetic iron oxide nanoparticles, or mesoporous silica nanoparticles, or MSNs, are the two top candidates for the nanoparticle portion of the complex. And that's because even though iron oxide has ion leakage, has a very important property of magnetic targeting, which is particularly the main thing that you want to look for when it comes to drug delivery in general. You want to look for anything that gives allows more targeting. So that's why iron oxide is one of the main contenders for this. And it's also one of the most well-researched nanoparticles in terms of the medical field. The other particle that I chose was mesoporous silica. And the reason why is because we can see that it's mesoporous in structure, which means it has a lot of pores on its surface that you can actually adjust, and allows for a lot of drug loading because that enhances the specific surface area that the silica nanoparticle has. So these are the two main nanoparticles that I wanted to emphasize, and I believe that are the best in terms of biomedical applications. In terms of polymer, I believe that chitosan and polyethylene glycol are the two best polymers because chitosan has many, many derivatives and is well researched, and it's also very sustainable. It has many different derivatives such as glycol, chitosan, dextrated chitosan, and you can genuinely modify it a lot. And polyethylene glycol, the reason why I chose that is because it has high solubility, stability, and it has this sort of stealth property. What I mean by the stealth property is that it has reduced protein adsorption. So when the immune system is actually trying to eliminate other foreign substances from entering the body, the cells actually have to attach to the foreign substances and destroy them. But what polyethylene glycol allows is reduced absorption. So those cells really can't bind properly to glycol, polyethylene glycol, and that allows it to sort of evade the immune system and actually infiltrate the cells and allow enhanced circulation time, which is proper for the drug delivery circumstance because you want as much circulation time as possible. Then you can actually modify it for different drug delivery methods, such as like a long in these long periods of time or short periods of time. So that's where you can really modify it with these polymers and these nanoparticles together. So that's why I chose these four candidates for the nanoparticle and polymer complex. Yeah, that is my research paper.
Great job, Aazan. And I want to let you know that Aazan held a workshop on puzzles, puzzle-a-thon, which was very, very interesting. So he's multi-talented and extremely driven. So thank you, Aazan. Your presentation was very good. You want to share your experience about the Gift to Gapper program?
Yeah. So I want to give special thanks to Dr. Christina Lalova because she really, really helped me in sort of getting the editing down and actually choosing my topic at the start, because at the start I wasn't really too sure about what I was gonna do. But her presentations like sort of enlightened me at one moment, and then I ended up choosing the right topic, and she agreed with me. And then we made the research paper. She edited it and really gave good constructive criticism to actually make my paper look better, can read better, and actually help me design the tables that I showed in the presentation. And so, yeah, it was really a good help in this process. As well as Professor Virgil, he also helped me like sort of structure it out, because in the paper I was talking about so many different polymers and different nanoparticles. So I had to sort of structure it out like that, the way it is. And so he really helped me with that, as well as the formatting, sort of giving me insight into how the table should look, and with the certain guidelines to the journal. So they were really good help. And as well, I want to give a special thanks to Gift to Gabber for actually providing the opportunity to do this research. Otherwise, I wouldn't be here right now. I wouldn't be giving this presentation. So yeah, I really do appreciate the professors and the Gift to Gabber and Dr. Lilova for helping me out in this process.
Excellent. A question for him, Dr. Lo.
Thank you. And we came simultaneously and independently to the same conclusion, which system should be the best for drug delivery. Yeah, which was very interesting. So my question is, so we have the systems, right, for drug delivery, we have the nanoparticles and we have the polymers. What do you think they would be suitable for another biomedical application, which is not drug delivery?
Okay, so that is a very good question. I believe gold in particular is probably the most like interchangeable in terms of the applications that it can go into because of the SPR function that it has. So when we look at surface plasma resonance, it actually has many different applications in sort of biosensing and bioimaging because it allows like sort of the resonance between the between the nanoparticles and the actual cells or the membrane, and that can be analyzed and sort of help in imaging with biosensors. So I believe I didn't do much research on that topic, but I believe it should be a very good gold or any other nanoparticle that has surface plasma resonance. It could be very good for biosensing and bioimaging.
Yeah, I agree with you. Thank you.
Okay, amazing. It's so hard to believe that these are high school kids. Okay, so it's like being in like a PhD kind of a thesis defense. So amazing. A big round of applause to each and every one of you. This program is not easy. You persevered, you survived, you showed up today, right? So that's in itself is a big celebration. So a big round of applause to each and every one of you.